Can genomic testing from pancreatic biopsies improve treatment? Imagine a tiny piece of tissue from your pancreas holding the key to better treatment options. That's what happens when doctors perform a biopsy and then analyze the genetic makeup of the tumor. Genomic testing from these biopsies can provide detailed information about the specific mutations and alterations in the cancer cells. This helps doctors tailor treatments that target those exact genetic changes, making therapy more precise and potentially more effective. Pancreatic cancer is usually diagnosed through procedures that collect tissue samples from the pancreas, often using minimally invasive methods like endoscopic ultrasound-guided biopsies. These samples are then examined under a microscope and tested for genetic information. Genomic testing, also called molecular profiling or biomarker testing, can identify mutations in the tumor's DNA, RNA, or proteins. Research shows that about 25% of pancreatic cancer patients have detectable genetic changes in their tumors that could influence treatment choices. There are two main types of genetic testing relevant here. First, germline testing looks for inherited mutations present in all cells of the body. This type of testing can reveal if a person has a hereditary risk for pancreatic cancer, which accounts for roughly 10% of cases. Second, somatic testing examines mutations that develop specifically in the tumor cells over time. This is the most common type of testing done on biopsy samples and can uncover actionable mutations that might respond to targeted therapies. Biopsy samples obtained through minimally invasive procedures are often sufficient for comprehensive genomic profiling. Success rates for extracting usable genetic information from these samples can be as high as 87%, depending on the quality of the sample. This means that most patients can benefit from detailed genetic analysis to guide their treatment. The advantages of genomic testing from pancreatic biopsies are significant. It can identify specific genetic alterations that are targeted by existing drugs or clinical trials, opening up options beyond standard chemotherapy. It helps distinguish patients who might benefit from personalized medicine approaches, which can improve outcomes and reduce side effects. Additionally, genetic information can provide insights into prognosis and help monitor how well treatment is working, especially when combined with other biomarkers like Ca19-9 or circulating tumor DNA. While genomic testing is increasingly recommended, it is not yet performed for every patient with pancreatic cancer. Major oncology organizations suggest that all patients should consider biomarker testing to optimize their treatment plans. This approach supports a move toward more personalized care, where treatments are tailored to the unique genetic profile of each tumor. In summary, genomic testing from pancreatic biopsy specimens offers a promising way to improve treatment for pancreatic cancer. It allows doctors to develop personalized strategies based on the tumor's genetic makeup, potentially leading to better outcomes. Patients should discuss with their healthcare team whether genomic testing is appropriate for their situation, as it can be a valuable part of comprehensive cancer care. Always remember, medical decisions should be made in consultation with qualified healthcare professionals who can interpret these tests within the context of each individual's health.